29 minutes to 9 a.m. this Monday morning. We're now taking a look at the COVID-19 pandemic within the country, and I'm joined by the Ministry of Health spokesperson Emmanuel Ainebyona to take a look at it with me. Good morning and welcome to Morning at NTV, Emmanuel.
Good morning to you, Rita, and good morning, viewers.
Let's take a look at where we as a country stand. As of a week ago, what we thought was the highest number we could have registered of confirmed cases of COVID-19 within the country, 66, worrying. This past weekend, 318 new cases confirmed, and as of yesterday, 97. In total, we have 2,263 cases. Recoveries stand at 1,199, and the deaths are at 20. The curve that was once flat is not flat anymore. What's happening?
Largely, the easing of the lockdown, coupled with the non-adherence to the standard operating procedures by the general population is what has brought us where we are now. But surprisingly, when you see today, everyone has a mask on. So I don't know why we need to wait for when danger is with us that we can adhere, because already a number of people are either transmitting the infection and they are still out there. So it is up to me and you to make a choice on whether we need to contract the disease, because even the hospitals will get overwhelmed. But you can still do something, because we still have a window of prevention by adhering to the standard operating procedures that were instituted by the Ministry of Health, by wearing our face masks properly, ensuring that we regularly hand wash or sanitize, and also keep a social distance. Where there is a crowd, you need to make a personal decision not to be there.
Okay, now let's go back to one thing that you mentioned, adhering to the standard operating procedures. Now, for many people, even the minister on Saturday came out to say the same thing. Is there something being lost in translation? Because when we say adhering, maybe I will understand it. But just making sure that someone who's watching is able to understand when we say adhere, what should they be doing?
If I say adhere, is to religiously or ensure that you do what the ministry has told you to do. Because in one way or another, this one will help you to stop acquiring the infection. So the power largely is with the individual. If you're going into a commuter taxi and you realize that either the conductor or driver have no face masks, why don't you opt for another taxi where you see people are complying? Because it is now getting to a personal decision on whether to contract the disease or not. As a ministry, we have preached the message of what each individual has to do. So we expect people to comply with the message, and where they are not understanding really, we also need that feedback, because we wish and we want to see them adhering to the standard operating procedures.
You mentioned something, you want the feedback. It's about 5 months now as a country since the first case was registered, yes? And the messages have come out here and there. You've gotten a number of people who maybe relate to the public to come out and say something. But what has been the reception from the public to the messages? Because if we see something, at some point the cases, people had said to do what was necessary. Even with the lockdown, the cases continue to drop. But then what we see now with the partial lifting is that more people, if you tell them to wash their hands, they're reluctant to do these things for those who are entering arcades, or just simply saying, put on your mask right. And some they're telling them you can't access this place unless you have your mask on right. Is this message not being heard? Are the people not listening? What is happening there?
Largely, we had, as you earlier stated, we had the flattening of the curve, which seemed to be like good news. But COVID is a very tricky infection, and it evolves. So when people, I think, started seeing the curve was flattening, they also thought maybe Uganda is almost defeating the infection, which was not the case. So our message is still loud and clear, like they did in March and April. Let us adhere, because the infection is now within communities.
Do you think that the message needs to change if we see that now it's the opposite of what you had been
Yeah,
achieving
the
as the
message
ministry?
is changing indeed, because previously we had that message that said stay home, stay safe. I think you no longer hear that message, because now there was easing of a partial lockdown, allowing people to go to their workplaces, allowing people to move in public transport from one place to another. So now the message has, wherever you are, ensure that you have your mask on, ensure that you sanitize, and avoid crowded places. Because that is the message. It's no longer stay home, stay safe, but ensure now wherever you are the surfaces clean, because the infection can be left on surfaces. Are you regularly cleaning the surfaces? Are you avoiding touching your soft parts? Because if you wear your mask, you will not be tempted to touch your soft parts. So that is the simple message we want people to listen to. But with the risk now, the risk is back, and I think people are starting to realize, because I have about 3 friends who got symptoms and called me. Where do I go? And after testing, they realized they were positive. So it is until when you get maybe someone close to you. So let's not wait to reach that extent, because the infection is there and transmission is happening. So let's ensure that we do not find ourselves in a situation where you cannot find a hospital bed.
You mentioned the health facilities, the preparation for this, because having 2,263 cases right now, and where are they? How is the treatment going? What is the health facility like? Because a number of times throughout this time, a number of people have mentioned we do not get a sense of what is actually going on in the hospitals. We hear, yes, people have been taken, but how exactly are they being treated? Are they well? Are the facilities capable to handle? Because what we are seeing is that the numbers might be increasing.
For now, those ones who are in admission across the about 14 regional referral hospitals, and also the National Referral Hospital Malago and Entebbe, are receiving treatment and they are attended to. But my reminder is that we might get it to a time where all these hospitals are full, where you will not have where to go, where the ICUs will also be full. So we don't want to get to that point. We still have an opportunity to avoid finding ourselves in a situation where you're pleading to get admitted. And when you see, because at one time the numbers had reduced, but if now I can look at maybe the previous days statistics in terms of admissions, I'm trying to see whether I can find one of the reports, and I give you a picture in terms of the numbers. The numbers of people that admitted, because at one time some hospitals had no patients. That's when we were realizing that there is a flattening of the curve. But surprisingly, in the last 1 week, all hospitals all of a sudden have the numbers full to capacity with small spaces left. So we need to be conscious and also cognizant that the numbers might overwhelm the system.
When we talk about the numbers might overwhelm the system, the World Health Organization has also given a few guidelines of how caregivers can be able to take care of their patients if they are sick at home, that at some point you can give them treatment from home. But how possible is that for us as a country?
It's something we are looking at because there are mild cases, there are severe cases. So there's already a protocol, a care protocol that clearly spells under what circumstances. But we have realized some countries that rushed for the home care option the numbers have increased exponentially, given that people at home might not follow the guidelines as it has been the case for the preventive guidelines. And that was the same even for quarantine. You know, before we registered our first case, we had an option of returnees undergoing self-quarantine at home, but this was abused. People would return and you would see someone taking a selfie somewhere at a cafe or with friends, and he has been in a high-risk country. So those are the mistakes we want to learn from other countries not to do here. And that's why we ended up into institutional quarantine for all returnees. So we hope that everyone knows this disease is very dangerous and they strictly adhere to the standard operating procedures.
Okay, now still taking us back to one of the areas that Minister did touch on during her presser on Saturday was the fact that workplaces are now a place where people are taking actually community transmission. Taking a look at workplaces and the standard operating procedures, how strict are they being? Are you following up on saying, particularly companies, what are you doing, what are you not doing? Where are we going with workplaces?
As I said, a number of workplaces have tried to ensure that they modify their premises and also scale down on the numbers. But I think there has been also that level of complacency where even workplaces realized maybe we need to operate to full capacity, and that's where there is a mistake, where you find at one time you have almost the same numbers used to have before COVID-19. So we need to think back on those strict measures on how you can have some people work from home and also have some people work in shifts where you are able to observe proper social distancing and ensuring that you have all the necessary supplies like sanitizers. You ensure that you're monitoring everyone that enters the premise with the temperature gun to know their temperature, record the temperature, and also keep monitoring people. If you realize someone has signs and symptoms, then you ask them to seek for medical treatment. Because I've realized there is a tendency of people saying, you see, I have a common flu, I have a common cough. So let's not live in denial. If you have any of the flu-like symptoms, it's better you reach out to the Ministry of Health toll-free line and also the KCCA toll-free line.
What you mentioned earlier is that it's more of that it's something to do with patience. Before we just quickly jump back into our normal routine as used to be, there needs to be something as patience. Touching on the patient bit of it, of course, someone will say, well, yes, it seems ideal, but right now as the economy, even with our kids saying, no, we're struggling, we're trying to get back to what we used to have, the money we used to make, and we need to just do as we used to. But comparing it to the fact that health is important, and there's also the money aspect of it. Yeah.
As the president has said, there is nothing worth equivalent to life. The money will come in later, as opposed to losing lives, losing some of your core staff. Because I think some companies have had positives. So you would not want to lose your core staff. You still need them because that money you can make in the future when COVID is all defeated and gone. So let's not rush into putting our staff at risk.
Okay. Now, as we talk about the staff, let's also bring in the refugees. Now, this weekend it was also highlighted that the refugee settlements were not considered when it came to mass distribution. That's also an area with a huge population within the country. And looking at who we need to be focusing on going forward, who needs help, because I believe as a Ministry of Health, 5 months later, there are key particular groups of people that are now vulnerable to getting it.
We are focusing on refugee camps, working with the United Nations High Commission for Refugees, UNHCR. we ensure that they have everything to use: hand washing facilities, face masks. Even the UN procured some face masks for the refugee settlement, and also government will ensure that the refugee settlements have face masks, because we are aware that there are some people who sneak out of the refugee camps, return to their countries, and we have had a case of a Congolese who had sneaked out, went back and returned with COVID, and unfortunately succumbed in one of the refugee camps. So that is not correct, that we have not distributed face masks to refugee camps.
So you're saying that you have in each and every settlement?
They are one of the high-risk groups. Maybe some might not have been reached, but the major ones, the known major refugee camps, have face masks.
And those that you say, the some, the others?
That one, even the current distribution, we haven't covered each and every district, so it remains work in progress.
And exactly 5 months later, the cases continue to rise, and I know it's a work in progress, as you mentioned, but how fast can we see this happening? Because if we do not, one area that you might focus on...
The major bottleneck was the local availability. We are relying on the local suppliers, the local manufacturers, and we've not had a capacity really that meets our general demand. So we expect them to enhance on their daily production, because we rely on the production to distribute the masks.
Don't you think that in one way it will affect the fight that the Ministry of Health is going on with?
There have been very many groups of people who are making masks, and affordable masks. So do not wait to, you can be waiting for the government mask, but you can protect yourself by finding a mask that can protect yourself as you wait for a government mask, because health is responsible, is an individual responsibility. It's you who will decide whether to contract or not to contract COVID.
Okay, lastly, you mentioned that it's an individual responsibility, yes. And this goes back to behavioral change that we need to see within the community and the country at large. And one thing you mentioned today is that perhaps it's because of the fear that there's that potential lockdown looming for many, that we saw downtown saying, not another lockdown, please, and we see that people are wearing their masks and doing what is necessary. Taking just a conversation to what people need to do for their own sake, as a Ugandan who's watching, what can they do to help with a drop in these numbers?
You know, it's not that putting on the mask, they are doing it to in government's favor. It's in their favor. If you put on your face mask properly, if you sanitize, if you are very vigilant to know who you are interacting with, where they have been, their travel history, where they work, it is all your individual responsibility. The government has given you the right information to help you take the most important decision, because we have not even finished coming out of the first lockdown. So we do not want to be in a situation where we are going to have the worst in terms of our livelihoods, finding what to eat, yet we can do what we are supposed to do and avoid the lockdown, avoid coronavirus. And that is my appeal. Make it an individual practice by doing what you're supposed to do individually, okay. Not waiting for enforcement. But there has been an established multi-sectoral technical task force which is charged with enforcement. So you would not want to be a guest or a victim of the enforcement.
What does that mean for the task force? What will they have to do? Or what
largely
if you're
one of their core is compliance. So they will be doing spot checks on workplaces, on arcades. Those ones that are found non-compliant will have to face the law, because they would have been in breach of the statutory instruments issued by the Minister of Health.
Is there a particular charge that someone would face on that?
Those are some of the things that will be coming up in the subsequent communications.
All right, we will hold you to that one, and we'll definitely know here on NTV. We'll keep you on that. Thank you so much, Emmanuel, for joining us on Morning at NTV. As you have heard from Emmanuel Ainebiona, who is the Ministry of Health spokesperson, that there's an individual responsibility that you have when it comes to the fight against COVID-19 in the country. As we wrap up Morning at NTV, remember that you should wear your mask right. Remember to wash your hands thoroughly with soap and clean water, sanitize, and maintain a social distance if at all you're in any public place or you're more than 2 people in an area. From us to you, have a good day. We do expect that this week, the president said last week that he would be addressing us as a nation when it comes to the fight against COVID-19. But from us to you, have a good day. And for any developments on NTV, we will keep you updated. I am Rita Kanya.